After 1 minute and 5 minutes after birth, I examined the baby's appearance. I noticed that her skin is pinkish in color, and based on the Apgar scoring, I rate her into 2. The infant's pulse rate is 130 beats per minute, and I rate it in 2 because it's normal. The infant's grimace is minimal in response to stimulus that I introduce. So I give the score 1 based on the Apgar scoring. The baby's movement is 2 because she's active. The baby has a vigorous cry and the respiratory rate is 40 beats per minute, which is usual to the newborn baby. So I give it 2 in rating. So when I add up all the scores, I get a total of 9, which signifies that the baby is in the finest possible health. The ballad score has 2 content. One, the neuromuscular, and the other one was a physical maturity. I used the ballad scoring technique to determine the physical maturity of the newborn infants. While examining their ballad scores, it uses a 1 to 5 scale to assess the physical maturity. When I examined the baby's skin, I noticed that it is smooth, so I give it a score of 1. I saw the existence of lanugo and I found it to be thinning. Thus, I give it a 2 rating. So because the baby's breast is stippled with 1 to 2 mm, I give it a rating of 2. The eye and ear will curve, pinna soft but ready to recoil. In terms of ballad score, I give it a 2. The female baby genitals are prominent. Thus, I give it a 2. When I add up all the scores that I evaluate, it makes 10. And when I compare it to weeks of maturity in ballad scoring, it becomes 28 weeks of gestation, indicating that the baby is premature. I'll discuss to you how to care of your baby since you are still 16 years old. After giving birth of your baby, we're going to dry immediately your baby. We make sure to wipe her face, back, arms, and legs to prevent hypothermia. After doing that, we're going to place your baby to your abdomen. We call that unang yakap. We let your baby feed on you within 90 minutes to ensure early breastfeeding initiation and rooming in. Because the earlier a newborn begins to nurse, the lower her chance of dying. While doing that, we're going to observe the feeding cues of your baby, including tonguing, licking, and roofing. So now, mom, I will explain to you how will you clean the cord of your baby. Before doing that, mom, make sure you wash your hands before touching the umbilicus of your baby because it will prevent any infections to your baby. So it is essential to clean your hands. Wash your hands rather. Fold the diaper below the stump. Keep the cord stump loosely covered with clean cloths. If you think that the stump is already soiled, mom, you can wash it only with water and soap and dry it thoroughly with a clean cloth. And if the umbilicus is red or it draining pus, you should seek of care. If you see any pus, redness, and itchiness to your baby, how will you treat it in your home? You can use the antibiotics such as polysporin. You can get that in any drugstore near in your town, but put only a tiny amount on the belly button using the antibiotic that you purchase. Do this 3 times a day after the area has been cleaned. Do this for 2 days. After that, use the antibiotic ointment only if you see more pus. Make sure, mom, that you keep it dry always, because it is important to keep it dry so that it will prevent any infections to your baby. Hi, mom. Good morning. For now, I need to explain to you how the proper breastfeeding of your baby. But first, I will discuss to you the essential of breastfeeding. First, mom, when you breastfeed your baby, it will protect her in any gastrointestinal infections and any gastrointestinal development. It will also help your baby in development of her immune system. And it also helps their cognitive development. And of course, the infant who are breastfeed are have reduced risk of obesity later kumpara po sa mga formula na binibigay ng ibang parents to feed their babies. And it will lower their risk of infections. Like for example, otitis media, lower respiratory tract infections, diarrheal disease, allergies, eczema, meningitis, and inflammatory bowel disease. Did you know that breastfeeding children is performed better on intelligent tests? That is why, mom, breastfeeding is essential to the newborn babies and every babies. So, how it will benefit to you, mom? It will benefit to you as well because number one, breastfeeding will reduce risk of breast and ovarian cancers. It will also enhance your bond with your baby. And in terms of socio-economic, ma'am, makakatipid po kayo kapag nagpapa-breastfeed po kayo. Kapag po kasi breastfeeding kayo, ma'am, yung baby ninyo is hindi po magiging sakitin. Kaya maiiwasan din po yung laging pagpunta sa hospitals. Tapos magiging economically productive pa po kayo kasi yung anak ninyo hindi sakitin. Which means, hindi nyo na po siya kailangang bantayan lagi. So in terms of breastfeeding of your baby, you can breast your newborn baby to 5 to 10 minutes per breast for only 2 to 3 hours feeding. 10 to 13 hours a day. So when your baby is in 1 month or more, his stomach will get larger. So you can breast her for 20 to 40 minutes per breast. And by 6 months, your baby may breast at you for 20 to 40 minutes per breast for 3 to 5 times a day. If breastfeeding is not possible, mom, there are others options for that. You can use the breast pump, the electrical one or manual one, cup or bowl feeding, eyedropper po or feeding in syringe. And you can also get the milk from a donation. I will now discuss to you how the proper positioning of breastfeeding of your baby, mom. Number 1, cradlehood. Cradlehood is that infant's head is supported in the elbow. The back and the buttock is supported by the arm and lifted to the breast, just like this po. Football hold position. The infant is placed under the arm, like holding a football. Baby's body is supported with the forearm and head is supported with the hand. It is a good position after operative procedures, just like this. Side lying position. The mother lies on her side, propping up her head and shoulder with pillows. The infant is also lying down, facing the mother. It allows the mother to rest, just like this po. Cross cradlehood position. Mother holds the baby crosswise in the crook of the arm opposite the breast where the infant is to be fed. The baby's trunk and head are supported with the forearm and palm, while the other hand is placed beneath the breast in a U shape to guide the baby mouth to your breast, like this po. And Australian hold position. This is also called the saddle hold. Usually used for older infants. Best used in older infants with runny nose, ear infection. Just for example, like this one po.